although these changes are happening, it does not necessarily mean that it's going to cause a problem. I can use a person's 10 out of 10 pain and compare it with that same person at another stage. Pay now or pay later, but with interest.
I don't even know what a world without pain would be like. Tumors have been resolved from ultrasound, and people don't even know it. Good evening. We've got an interesting talk today. We're going to go through and
Mm,
discuss how we view the body and the different layers of the body, and how
mm,
we look at these different layers when we're trying to resolve our issues and bring balance to the system. But we're just going to look like on a slightly deeper level than just looking at muscle,
mm,
ligament, and tendons, but just looking at the stages of what they go through. So that should definitely be interesting. And then hopefully, as we go through that stuff there, we'll prompt any questions coming up during that time there, because have it more like an open discussion forum. I'll be asking Christoph certain questions as well as we're going along.
mm.
And I also feel that as we get clearer with the understanding, then when we enter into these kind of situations and we're being explained certain situations with our body, we have deeper understanding. This is the
Yeah.
aim.
And then because we've been doing a lot of ultrasound scanning, and it's given me the opportunity to really see, you know, what I'm feeling, also seeing what people are describing, seeing what people are feeling, and then also matching the parallels and seeing if there's a relationship or difference between everyone in regards to the symptoms that they feel. So it's been really interesting, this whole process, because it's the first time that I can really examine and put the whole picture together.
Mhm.
Yeah. So, all right. So what we'll do, I'll start, and I'm sure people will gradually come into the chat as we I go forward. So let's see. So all right. So what I'm gonna do, I'm gonna just share my screen, get that presentation up there before I do that. Yeah. And yeah, if there's any questions, do ask, and this should be an interesting conversation, very relevant, because as me and Sohu's been practicing, the combined years of experience, we called it where diagnosis meets reality, because oftentimes, there's a gray area, and everyone's reality is different, as well as everyone's diagnosis is different as well. And that's based on different things. Yeah. So where diagnosis meets reality. So when we're looking at diagnosis, we're looking at labeling a condition, So when people come to a physiotherapist or any healthcare practitioner, the aim of that assessment is to give them a diagnosis. So a diagnosis being a diagnosis in simple terms is basically a label for something. Yeah, a label for usually an injury. And we might ask, okay, why do we want a diagnosis? Because it's what we can really do from the diagnosis. Um, a lot of the times when people are looking at diagnosis, sometimes the diagnosis can help inform their treatment, and other times a diagnosis can add a little bit more confusion, depending on the language being used. So it's also, when one receives a diagnosis, we're looking at different variables that make it up. So it might be by the way someone presented to us. So, for example, if someone's limping because of knee pain, or in fact, if someone is limping, we can assume it might be pain. We might assume that it's knee pain, we might assume that it's ankle pain, or it could be hip pain, or it could be something where one side of their back has given out. So, the first impression, someone who we might think of all these different spectrums. And now to get in a clearer clinical picture, we have to do more investigations to see exactly what part of the body structure is being affected. So then the question will be, okay, how might we differentiate between if it's knee pain, ankle pain, hip pain, lower back pain? So then we might do further tests such as, okay, let's isolate all the limbs. Let's isolate the ankle, see how the ankle's moving. Okay, let's test the strength of the ankle. Has the ankle got its full power? Then we might go, okay, the ankle's moving quite fine. Let's move on to the knee. Is the knee moving fine? Okay, the knee's moving not as fluid as it should be moving. And then we might say something like, okay, all right, so we can see there's something going on with the knee, but okay, we got to be certain. Let's check the hip. Is there something going on with the hip? So then we might look at the hip, we might have a look at the movement, and we might see, okay, the hip is moving relatively well. It's got good strength. So then our attention, as we do more and more of these investigations, our attention becomes more and more focused. So we might think, okay, there's a problem with the knee now. Now, what part of the knee is being affected? So we might use our fingers and we might palpate an area and we might feel, okay, the back of the knee feeling fine. Is there any pain here? We might go to the front of the knee and we might go, okay, there's a little bit of discomfort at the front of the knee. So basically, what we're doing through the whole process, we're narrowing down to see if there's something specific which is causing a problem. Then we might label the problem based on other structures that has been identified by other people in the past. So we're very much aware of things like in the knee. It could be to do with the patellar tendon. It could be the ACL, which might be giving problems. And we've got a whole range of research in the background that might give us an idea about, okay, has this problem been seen before based on the research that is out there? And okay, we might say, okay, this fits into this similar pattern. Is it responding the same way as these previous tests that has been done in the past? So essentially, what we're doing, we're narrowing down to find a specific cause. And in a lot of cases, that can be very helpful. But then there's other cases where a specific diagnosis might add a little bit of confusion. So when we're looking at something like, let's say, patellofemoral pain syndrome, we know that it's pain around the whole patella, which is this bone here, the kneecap, and the femur being this bone here, and there might be pain around that area. And then in our investigation, we might find that it's actually not one specific cause of the problem, but it might be the whole biomechanics and the way things are moving. So then we want to treat very holistically. In other medical conditions, doctors will do certain assessments, again, based on a history of what's been known before in the past, to identify things like chickenpox, to identify things such as food poisoning, etc. And then essentially, with all the technology we have, where we have ultrasound scans, we have MRIs, we have endoscopies, we have all these other things that add even more value to our assessments. And from utilizing these things, we can be very, very certain and even confirm certain of these diagnoses. Now, what's really interesting, and this is kind of where diagnosis meets reality, is just through the experience and observing things as I go through this ultrasound course, you can see how there are changes to certain structures. Let's use the patellar tendon, for example, and we might see that if we done a scan without the patient having any symptoms of pain whatsoever, we might find there's certain changes that happen as we naturally age. So we might find that the pattern in the tendons here becomes disorganized. We might find that the tendon from repetitive use, repetitive trauma, although not the problem's not active at the moment, we might find that it becomes a little bit thickened. And we might find that the bones, again through repetitive use, might become a little bit irregular. So observing through the ultrasound, we might see that the bones are looking a little bit rough. Now, just because we see all of these things, it does not necessarily mean that it's going to elicit a painful situation in a patient, a client, or a person. We might see these changes, and these changes can potentially indicate that, if we exacerbate the problem further, or if we do too much without correcting the causal factors, then they might start to cause problems. So there's been a lot of research about this same part, um, the patellar tendon, and it shows that even in soccer players, that through the repetitive use of their muscles and that tendon through playing football, there can be changes which are very indicative that there might be a problem in the future and that there is a correlation between the two. So in saying that, it's really important to just be aware that, yes, we're going through changes. Our body does change as we get older. There's a lot of things that we can do to help slow down that process and help mitigate that process. But at the same time, although these changes are happening, it does not necessarily mean that it's going to cause a problem. So because of that, we would never really just do a scan and a diagnosis using ultrasound and just put the scanner on a person who's not having got any problems or any symptoms. Because again, we might see these changes, but then the changes doesn't make sense in reality. So then the question is, how is the interpretation being interpreted correctly if we was to make such a statement or a diagnosis without there being any clinical symptoms? So that's why there has to be usually symptoms, and we have to go through a process of narrowing down and eliminating other possible causal factors before we, look for further investigation through MRI, ultrasound, etc. So in the question of diagnosis meeting reality, we have to look at reality to help make up a bigger picture and gain a better understanding. So I'll just talk to you about just a few examples in different parts of the body. So you may have seen this model before. So this is basically showing a degenerative process of what happens in our spine. And in most cases, this is a process, it can happen anywhere in the spine, but in most cases, from the population I've treated, this is usually happening in the lower back. and specifically the lower vertebrae, L4, L5, etc. And that's because all the body weight goes down and then it kind of divides in that area. And then we've also got the lordosis, which also is a point of pressure between L4, L5. So when we're looking at here, we can see this is a normal disc, nice smooth. And then as we can see here, we can see the outer layer of the disc. So inside the disc is like a gel-like substance, which I'll show you. This is just an example of a herniated disc, which I'll go down a little bit. But on the outside is tougher because it's meant to keep the spongy area in contained. But what happens through the process of degeneration, we might get cracks in the area, or we might get just the gradual wear and tear, which basically will reduce the integrity. Now, as this is reducing the integrity, we might get a little bit of bulging because now this fluid, this gel-like substance, which helps to which helps to cushion, that's the correct word, which helps to cushion the actual the vertebrae, that starts to kind of weep out a little bit through areas of the weakness or the areas which are has less integrity. And as it does this, then people can have disc bulges. But what we can see is that we might have someone suffering from lower back pain. And we might see that because their back pain is, troublesome enough for them to actually see the GP, they might have an MRI scan and they might see in the MRI scan that there's quite a few bits of bulging in the disc. Now, with the bulging in the disc, we can't make a conclusive diagnosis that it's because of a bulge or a small bulge that this is the main cause of their problem. Because again, that only tells us part of the story. And this is where we have to do the various tests, etc., just to see how much of this is contributing to the pain. But oftentimes what we will find that over a certain age, definitely over the age of 40, even as young as 30 and late 20s, we will see that in people without any symptoms that they can get a bulging of their disc. As things slowly degenerate through a process of further aggravation or a process of old age and muscles getting weaker, what can happen is sometimes these discs can bulge a little bit more and then become a little bit more herniated. We can also see herniation in, let's say, younger people who's performed a poor technique with a squat or a deadlift, etc. And in those cases, we will see a lot of the reabsorption of the gel being reabsorbed back into the disc. But where it's a degenerative process, we can see over time with age, etc., that less likely to take place. And then I'll just talk about this here because this is what we will call arthritis in the spine, where basically, again, through a process of wear and tear, we can get such flattening of the discs that now the bones are starting to rub on each other, and that rubbing on each other causes friction. The friction causes things like bone spurs to develop, etc., causes pain, stiffness, reduced range of motion, etc. So when we're looking at this whole degeneration, what's very important to note is, again, it's a process. And we've got to, when we're doing any further investigations, we have to know how things happened, you know. So there's a pathway of degeneration which happens as one gets older. But then a young person can skip all of these processes and herniate their disc by, having a traumatic injury to their back, you know. So then we've got basically two different diagnosis within the same problem or same condition, and how we would treat both of these problems will be in different ways. We would expect a young person who's herniated their disc, um, you know, again, so we've got, okay, so let's say three scenarios. We got person A, a heavy lifter in a gym, traumatic injury. That could be on this pathway, one problem, herniated disc. Then person B, slower degeneration, 30 years of back pain. They can be, that's another pathway. Then we've got another pathway, which is where a lot of people will sit, which is not really a problem because it hasn't got the whole, it's a very asymptomatic, but we can get people, let's just say half the population of anyone that's been on the computer desk for the last 20 years or so, we can get this group of people who might have bulges in their disc but not have any symptoms. So then again, we wouldn't necessarily diagnose it as a problem or label it. We will kind of identify as, this is what it is. I mean, some people might diagnose it as a problem. Other practitioners, there might be a split, but I think most practitioners will see it, they might talk about it, they might explain natural processes, but at that point, it wouldn't really fit in with anything else, it when we're looking at the free pathway, we can see that they're distinct and there's different management. So a person with just a bulging disc, they might be able to continue with all their activities of daily living, etc. No problems, but still I would encourage that person to keep up with core exercises, strengthening Pilates, Tai Chi, all these conditioning exercises. But I would place that emphasis on a person with bulging disc as much as a person with slight degenerative disc or even a normal disc to help slow down and prevent that problem. But yeah, let me not, I don't want to lose anyone by trying to over-explain. Because again, reality, you deal with reality as reality presents with everything else. Okay, so this is another interesting concept. Pain threshold. So when we're looking at pain, we're looking at two types of pain. We have nociceptive pain and neuropathic pain. Nociceptive pain is, let's say I bang my elbow, the area swells up. Because the area is swollen up, it changes the chemical activity in the area, changes everything to promote the healing response. As that changes, nerve endings become very sensitive. As they become sensitive, that gives us our feeling of pain. Neuropathic pain is basically burning, tingling. That's actually when the nerves are being directly compressed. So the same nerves that are usually responsible for giving us some sensory information, when they get impaired directly, then they can cause neuropathic pain. But again, now when we're looking at pain threshold, everyone's pain threshold is different. And pain threshold can vary depending on um, a person's previous stimulus to past pain. It can change, just to give an example. So, for example, let's say a person that's never been a day in a gym in their life compared to a person that's been going to the gym for over a decade. Now, they could be doing the same exercise, the same lunge or something, and the person doing the lunge might feel they might be doing, let's even say if the person doing the lunge or who has been doing exercise for a long time has a high uh, relative weight for their what they're used to. Okay, no, I'm going to explain it differently. When in a practical sense, I think it will be better to talk about it in a practical sense. In a practical sense, I can have clients and both of them might be have a similar injury. One client might have more swelling, more redness, the area might be more inflamed, and they might report less pain than another client who's got less pain, it's less inflamed, it's less red and less swollen. And the reason for that is because we're all wired differently. You know, our pain responses are different. Our pain threshold is different from a person who's used to pain might have experienced pain in the same area before, whereas a person who might have had that pain for the first time, you know, because they're unaware of what to think or feel, they might have a heightened response because it's very new for them in terms of neurostimulation, etc. Then we got people with chronic pain. Now, someone with chronic pain might have hypersensitivity to pain because now the neuromodulation of the nerves has been heightened. And it could be, in a sense, in a way, just to make them more aware of how to protect an area that has been under duress for such a long time. So when we're looking at pain and making a diagnosis, if I ask yourself or clients or whoever, are you experiencing what out of 10, tell me what your pain is. Some clients will easily say 15, and I've only given them up to 10. Where some clients, you know, I know they've been in a traumatic situation and they might report something like only 4 out of 10, you know. So when we're looking at pain, because it's so relative to the individual, I can't compare someone else's one to someone else's one, nor can I report someone's 10 out of 10 pain to another person's 10 out of 10 pain. But what I can do, I can use a person's 10 out of 10 pain and compare it with that same person at another stage. And just to give me an idea, but again, still, we won't, as practitioners, be able to take that at face value because someone might just be in a different mood. If someone's in a more emotional state, upset state, you know, they're going to feel the pain, a similar pain more intensely compared to if someone feeling very happy with endorphins buzzing around their body, you know, they're going to experience pain less. Again, the situation, the fight and flight, you know, if you got, unfortunately, let's say bitten by an animal, and you have to run away from the animal that you've been bitten by so it doesn't bite you again, your body's not really gonna, you know, the way I understand that we were wired by God or whatever you believe in is to allow us to get out of a situation. You know, so when we're bitten, we might, the fight and flight, the adrenaline will be buzzing. So that will allow us to still utilize that limb in a way that will allow us to quickly move and get to safety. Now, it's only at the moment that we stop then do we begin to realize the full gravity of the pain. And then this is why pain itself is so subjective, so variable. So many things influence it. The weather can, one's diet can, if you're hungry, you're starving. Or, like when I was doing Ramadan and, to participate, get the experience of, just fasting and the whole 9 yards. I mean, if I knocked a body part, I'd feel it a little bit more, compared to other time where I'm eating plentiful, I'm doing my gym workouts, etc. So what I'm trying to say is pain varies so much that we can't use pain alone to say, okay, a person's inside of the ankle or outside of the ankle hurting a lot, they have a sprain. We have to use other things. So let me move on. Right. So similar to the degeneration that happens in the back, um, this is different stages of knee arthritis. And again, what I would see is if we was to scan people, we might see slight degenerative changes that might happen in the knee. But again, I get the question of, okay, oh, is this arthritis? Or, have I got arthritis? And when we're looking at things like arthritis, it's on such a continuum where there's no arthritis to there's severe arthritis. I need my knee to be replaced or my hip to be replaced. And everyone's somewhere on the continuum. And when we're looking at that continuum, you know, we get the question of, okay, have I got osteoarthritis? We never get the question, is there degenerative changes that is slowly occurring in my knee? Because people just know the word osteoarthritis. And usually when we're looking at osteoarthritis, we're looking at the whole, the pain, the severity of the pain, the reduced mobility, the how one's activities of daily living is affected, compared to someone who might have slight, changes in the bone, slight wear and tear, who can play, a full game of tennis. So again, when we're looking at diagnosis, sometimes we can get very caught up on the word and the diagnosis, where yes, it's important to know, but it's also equally important to understand enough to allow us to act upon it. So, if one is getting, a bit of knee pain, they might be frightened of, okay, am I developing arthritis? But at the same time, and this is my personal approach on how I conduct my body and, my life and, my rehab, etc., is I personally am very much more concerned of, okay, I've got a knee problem. Okay, I understand that my understanding as a physiotherapist helps to eliminate a lot of the worry and the doubt. But my approach will be, okay, knee's problematic, starting to develop pain, starting to become very painful, running, etc. Let me see what I can do to offset this, either treatment-wise or focused, dedicated strengthening exercises on that area to help lessen and reduce that pain and even help to eliminate that pain. You know, again, not everyone has the experience of being a physio or osteopath or whatever healthcare practitioner. So it's still an opportunity to see someone about a problem. But what we do, it, yeah, I like these words here. I'm just going to use this doubtful. So when we're in this doubtful stage, you know, we question, we do nothing about it. Then we let it go to the mild stage. And then we go, okay, I can walk to the shops. It's been paining me. if I had to really check, it's been paining me for the last 1 year, 18 months, and I still haven't done anything about it. And this is what really happens. And then over many more years, it develops and develops, you know. Not all the time it will get to this stage. That depends on lifestyle and other factors. And it may never even get to this stage. But at the same time, there's still something we can do about it. And, the clients that I really commend are the ones who might have this type of pain here. So a little bit of mild pain because of their osteoarthritis, or just mild pain in the knee with they might not be sure of the problem at that point. Most of the time, you're not necessarily going to be sure. And these are the ones that will come to me, or even other practitioners, and they will get it sorted out. And you see it more in people who are active anyway. But it's something that, I strongly encourage people to do. Don't let things get worse. A person might say, okay, um, it's not that bad. I haven't got the money to pay for physiotherapy or osteopath, so I'm going to leave it. I want to save my money. But my saying is, if pay now or pay later, but with interest. And when you leave things, when things become more problematic, that's when it really costs you. And it doesn't just cost you financially, even though it would cost you more financially if you had to see someone at that stage, but it also costs them in the quality of life, etc. Not being able to do the things that you want to do, not being able to play football with the grandchildren, etc. So yeah, when we're looking at these problems, and that can happen in the hip, that can happen in the ankle, it's on a continuum, and we don't have to wait to give it a name of osteoarthritis before we do something about it. And again, this is where we get caught up in the name of things rather than actually how things are feeling and doing something enough so it doesn't develop. All right, let me move on. So, what I wanted to show here, not really the stages of muscle strain, because, muscles, a lot of strains might happen from sports or work related, but I really wanted to go onto onto this slide just to talk about, yeah, basically how the body responds. So here we can see a normal tissue, no injury. And then here is an example of a muscle being injured. We can see um, slight strains or slight tears in the muscle fibers. And then here we have it being healed, and scar tissue or extra collagen deposits being formed over it to help splint the area. And as I was at Fahu's Tai Chi class, and I thank everyone for allowing me to scan them. Um, what I saw was interesting, and it wasn't so much the problems that they had. That wasn't so much interesting. It was interesting to see from that perspective, but it was, the common everyday problems one can get in this whole musculoskeletal injury realm. There wasn't anything like tears, significant tears, or anything like that, which was good. But what I did see is a lot of reduced range of motion, a lot of, you could almost see some of the extra fibrosis over the scarred areas. You could feel, palpate the problem, that muscles were tightened or raised. And these were injuries that had been going on for more than 6 months. And looking at a particular group, especially a particular generation of a small section of the Tai Chi participants, you could see that they've learned to live with pain and learned to live with problems in a belief that, okay, this is what we're used to. This is what we're used to. Our parents before us, they dealt with a lot worse. I'm sure I can deal with this in a soft tissue problem. But what you could see, feel a lot of the extra tightness and the failed healing. There was almost this belief system, ingrained subconscious belief system, that actually it was the way it was meant to be. It wasn't going to get better. And when we're looking at, you know, the whole healing process, inflammation, which is where we would see when the muscle's injured, proliferation, where we'd see the extra collagen splinting and protecting that area, making it stiff to help return it back to a pre-injured state. The step that most of them were missing was the remodeling. And the remodeling was the strength and conditioning exercises to do for the problem. And I knew they wasn't doing the strength and conditioning exercises because I asked them. The best thing they was doing was actually going to the Tai Chi classes. Yeah, that was definitely one thumb up for even just participating because it was helping it that way. But they still needed to add an extra focus on it when they wasn't in class, and also certain isolated exercises to help remodel the area. And then another way they would have been able to help the problem would be things like soft tissue manipulation, which would have helped significantly. And based on my experience, I'm certain most of them, if they had known that, they would be a lot better than they are now. So again, when we're looking at strains, when we're looking, if I go back actually, when we're looking at grade 1, 2, and 3 strains, we know that a grade 3 is when it's completely ruptured, you know, and then we know that grade 2 is when at least more than 50% or half is ruptured, or in fact, I believe it's actually anything above even 2% to 99% if you had to go really scientific. But again, when we're looking at these problems and the grading, they're so finite, Again, yes, they give us a very good picture of what's happening, but again, it doesn't give us a holistic nature of what's happening. This is just a nice way for us to categorize it. So, yeah, that's just looking at the tissue healing, where everyone was at this stage, because this is basically what the body does. This is what we have to do. So we can see why everyone, or a lot of people just generally get to this stage where no one actually goes to the pre-injury level, because that's the only time they have to do something about it. So overall, I think the take-home message is, yeah, diagnosis is very, very important. Um, Very important, but we shouldn't at the same time be trapped, depending on the condition that is, on such a limited view of a label. Labels are just like, if, for example, we was to read about a dog, reading about a dog is different from an actual live dog within your space, you touching it, smelling it, feeling it, etc. Diagnosis is very important, because there's certain, conditions where the diagnosis is extremely important to share amongst health practitioners. And case by case is different, you know. But in the musculoskeletal sense of things, we've just got to have an open mind and not be limited. And the reason why we don't always want to be limited, and this is why you have to see, someone that makes sense of a problem you're experiencing. This is not about the take-home message being go on Google, diagnose yourself, and do whatever you like. No, this is, just giving you a broader view that changes happen in the body. Some of these changes will be seen very clearly on these images. Some of these changes won't be so clear. At the same time, with diagnosis, sometimes they can put us a condition in a box which might limit our rehab potential based on old information. Whereas nowadays, with this ever-changing technological world where more advancements are being made, we're understanding things better. And as we're understanding things better, now we actually have a range of other things that will be added into the box. But at the same time, there's some people already outside of the box making an impact on the labels, So it's just a discussion, basically, get everyone thinking that reality and diagnosis, it's an interesting topic, and reality and diagnosis can meet or it can be mismatched. And sometimes areas where we see it mismatched is where, scientifically we haven't got a lot of information, Sometimes certain conditions might be labeled. For example, fibromyalgia can be a condition which is often misdiagnosed from the sense of limited understanding, but also because a lot of the information, there's a large subjective of what a person tells you, which helps to make up some of that understanding. So, yeah, I think I've finished there.
Yeah, so Christos, before you finish up on that one there,
Hmm.
you never described that last chart there.
Oh, the last one. Okay, let me
That last
touch on it.
one and the four stages that because you mentioned it through the discussion for truth.
Yeah,
Various
yeah. All
stages of
right.
let's just break down this blood, this bleeding, this inflammation, proliferation, and remodeling. This is nice.
Okay. So this is basically the process of healing. Now, with the bleeding, we do often, that might not be in all the models. We definitely see inflammation modeling. A lot of the time, if we're talking about soft tissues, when we get a strain, we're going to get some bleeding of the capillaries.
Yeah.
But we're going to focus on, so we get information. Information, that happens within, as soon as one gets injured. Let's use an example of, yeah, let's say straining our hamstrings.
Well,
Yeah.
Christos,
Hmm.
that bleeding phase there
Hmm.
and the capillaries you're saying that can get torn and that can be
Yeah.
on a in the within any layer of the tissue, but this can
Yeah.
be basically around a basic strain as
Mm.
well as a proper tear.
Yes. Yeah. Yeah.
So
Yeah.
that bleeding phase, that one there, it can be from a subtle bruise, that strain,
Yeah.
bruise or knock,
Yeah. Yeah. Yeah.
and then
Like
yeah,
hematomas and stuff like that. Even a contusion injury. And with the inflammation where it might be separate from the bleeding, it might be something like a pathogen entering the area or a toxic stimulus in the area. So there's so many factors even outside of the soft tissues
Mm.
that can cause that inflammation. But let's not, I don't want to confuse it. Let's stay on soft tissue. So we get the bleeding and the inflammation. Yeah. Someone strained their hamstrings. Now, the inflammation process can happen over the next few days. They say it can happen up to finish at 3 days or even last as long as 7 days. Um, with the inflammation, this is where, we want to protect the area to prevent further damage because without going on a tangent, what we can see with certain injuries is that when we don't allow things to heal properly, they get re-injured and then they make attempts to heal again, and then we can re-injure it just by the smallest of things, which is why we need to protect the area, and that can lead to another pathway of problems. But in a simple sense, when we're looking at inflammation, we're looking at the histamine, the white blood cells helping to clear the debris out of the area. We're getting the swelling, the warmth, etc. All of these things, including the pH of the area increasing, the voltage increasing, all of these things are basically to help kickstart the healing response. Now, when we're looking at proliferation, proliferation is now where the body starts to get extra collagen layers to help protect and splint the area so that further damage can't be done. Now, with the proliferation stage, that can happen over more over 7 days. It can happen, last up to 2 weeks or so. And I often felt this when I was treating a lot of whiplash clients. And the good thing about that particular job is I had the opportunity because of their insurance, and I was working for one of these big physio companies that had lots of clients in. I was able to really feel the different stages of the healing process. So when it was very inflamed, everything will be feeling very warm, hot. And the techniques I would do would be more of a desensitization, where we'll be getting them used to touching the area, helping to with a bit of the lymphatic drainage, etc. And then, over a few days or so, or the next week, you would literally feel that area become tight now. So at that stage, they felt stiff, but things weren't painful. At this stage, things were very painful. Even just to move it will be very sore. But now at this stage, they could do a lot more, they could walk more, etc. But things will feel very limited. And with that proliferation stage, now to help restore the muscle back to its previous pre-injury state, we would have to work on the remodeling. Now, that remodeling phase can take how long it needs to take. Sometimes the more severe the injury is, the longer it can take. In the best case scenario, we're hoping that, after 4 weeks or so that, one can return back to 100%, problem free, again, depending on the severity. Whereas, I've seen some cases with a lot of some of the severer car accidents where it's been months before they've returned to full function and fitness, as they was going through the remodeling. And with the remodeling, what I will be doing is trying to work out the tightness through whatever means, acupuncture, massage, etc., so that the muscles became more pliable. But then at the same time, trying to strengthen the muscles so that actually now it has integrity. So that's the whole remodeling process of taking over from where the body's left off to taking over the baton to get it to 100%, you know. So yeah, that is that process, that whole healing process. I know we done a more detailed talk about that. It's somewhere on the Tai Chi Future YouTube channel. I think so. Or
Which
we
one?
may have done it
What talk
on,
you thinking about?
we might have actually done it on another platform actually. We may have done it on Leon's platform.
What was that talk that come to your mind?
Information, the healing process. We done a talk on that one.
Yeah,
Whole presentation.
yeah, I think that could have been,
Yeah. We might have to revisit it here.
And then it's true because I think it was doing looking at electricity as well and voltage.
Yeah, yeah. I think that was part two.
Yeah, I think that
Yeah,
that'd be good to retouch them topic again. Yeah, but that was because that those four stages are key.
yeah, yeah.
I think most of us are aware probably of the second stage, inflammation, and then
Mm,
assume the third stage to be edema. I don't really
hmm.
even investigate the appreciation of the fourth stage of remodeling.
Yeah, so no, yeah, definitely we get the edema in this stage, but then there could still be edema left over by the time we get to this stage. But this is where the edema would be building up, you know, in the inflammation stage. But again, it does depend on what the problem is. Because as we know, is some of our clients might have long-term edema that's just been sitting in a limb for God knows when, you
Hmm.
know. So, yeah, it's the reality about the body is as much as we try and as much as the textbooks say, you really can't put in any textbook or category, you know.
You-
Even when we have to look at the names of certain of these conditions, certain of the names are confusing enough because they're labels. So, what is tennis elbow to a culture that's never played tennis,
hmm,
you know? Or what is Osgood's? Osgood's is named after someone,
hmm,
you know. So the name, I mean, in the clinical world, we know what it means, but in the outside world, if you never come across that problem, then you'd have no idea. If I started my own community and my own tribe and just labeled things after my favorite singers or something, based on what they do on my favorite athletes. This is Henri's foot, or this is Usain's knee. You know, it's a name, but the name might not tell you. So, for example, where you have tennis elbow, lateral epicondylitis is a better name, but then because that process is a degenerative process, you know, with inflammation, the itis at the end, you know, might throw someone off if they had to look at the root meaning of the name. So
hmm,
yeah, names are interesting, you know. It goes back to the original names of, when we're looking at Adam and Eve, you know. So when you look at the name of Adam, you can see that Adam went around with Eve, or I'm not too sure if he done it before Eve. He
yeah.
went around naming things. That's a whole nother story of if he done it without Eve or not. But
What the
Adam went around naming things.
yeah.
But atom, an atom is what names an element based on the number of electrons. So one electron more, then it has a completely different name.
Hmm,
So we see the parallels if we had to go into the metaphysics of naming stuff,
hmm.
which is another story. Yeah. So yeah, any questions?
And yeah, man. Any thoughts from anybody? But that is a nice description of the model. I think that
Mm.
something like that should be probably described to everybody.
Yeah, yeah. Well, I do find that in the clinic, I am going over this model. Depending on the client, I might go over the voltage theory, you
Mm,
know. But yeah, no, I find they find it really interesting,
yeah.
because they just don't know what they don't know. And it's understandable,
So it seems
you
like
know.
a few models that we have to educate and train people with. That's one.
Yeah.
The pain model is another one.
Mm.
That's a model
Yeah.
that we definitely have to educate people on their perception. Because as you
Yeah.
described, it's all relative. But if it's
Yeah.
all relative and it's all emotional, weather, and all these different conditions having an effect on it, and we have to
Yeah.
take things into account, and then someone has to be brought, it has to be, they have to be taught how to perceive pain.
Hmm. Yeah. Yeah, because I mean, yeah, it is about perception because there was a point in my childhood where, I thought tendons were bones and bones were, I knew bones were bones, but I just have to look at that and feel it was hard and I just think that was a bone, you
Mhm.
know. But I use that example because that's how people do view the body.
Yeah.
They view it not maybe in that direct way, but they view it like that because, unless you're a healthcare practitioner, you're not exposed to what the body really, really looks like. You might see a picture of the body, but until you've been in the dissecting room and seen the soft tissue,
True.
until you've treated a patient that's had a massive hematoma, until you've felt thousands of patients with problems, tightness, and that, you have a perception of the body which is a different perception of how what we would have about the body. And then again, perception between every individual changes as well, because not everyone sees red as red. So we know that not everyone feels a tightness as a tightness, you know. And people sometimes, even when you look amongst the healthcare practitioners within our community, we can see that some practitioners, based on the environment that they're working there in, they haven't had the time to really explore, what things feel like. Because when you have to get on the go and assess, treat, whereas, I know me and Sahu have been fortunate where, our sessions can be as long and or as short as we need them to be, and then, there's a whole other component of when you build up certain therapeutic relationships with clients, then you understand them, and by understanding them, you understand more about their problem. And then you see all these patterns, these variations, on how environments will affect one. So, again, it's good to name things, label things, but we should put more emphasis or equal emphasis, I should say, on doing something about the labels. Because with one label, there's so many treatment mechanisms, you know. Tightness of the muscle, you can treat so many different ways, you
Mm.
know. Theoretically, that is. There might be one best way to treat it, but there's so many avenues to treat it, So yeah.
Yeah.
Very interesting. I've been on a journey myself managing pain.
Hmm.
I've done I've done 1 week of pain management, with St. Thomas's. I didn't complete
Mhm.
the 3 weeks because I got sepsis. Whilst there, I got ill.
Mhm.
Um, but what I found, um, that wasn't for me. All the things they were saying, I already been analyzing this for many years. I had movement that all what they were leading up to. As I didn't complete the course, I can't say what the end result would have been. But the first week, I didn't think it was applicable to me because I had movement. I wasn't having any psychological issues like wanting to commit suicide due to pain or anything like that. I was already functioning. So at that point, I thought this is not for me. And then I got ill. But then come recovering from illness and then going back on the journey of recovery, I had to step up my movement. So I decided to, because I used to do swimming before and that sort of thing, and aqua aerobics. But joining the Pilates, that gave me a chance to strengthen, which allowed me to return back to Tai Chi stronger. Because when I went to Tai Chi um, as a recovery, I was shocked at what I could not do
Hmm.
because I couldn't do much at all. So that sort of shocked me into thinking I need to strengthen. So I did a bit of research and then took up the Pilates, and that's aided me to be more comfortable to use my joints because up until that point, if I felt a twinge, I wasn't going to do anything to aggravate it. But now, because of that, I'm able to sink into my Tai Chi and I feel happy psychologically because I'm able to do a lot of the postures better than I was doing before, even before that. So I'm able to squat a lot better. So what I'm really saying, movement with pain is really important because your
Mhm.
brain is saying, this hurts, but you have to bypass that um, thought to get
Mhm.
that body moving, to be more flexible. And what I have seen now is that the inflammation around the knee has reduced a lot because
Yeah.
now I know what I can do, what is possible, and even bending the knee, like there's a position where you bend your knee. I've forgotten what it's called, but you bend your back knee. So you're sitting on your back knee as you're bending. I
Mhm.
wasn't able to do that. And Sahu was showing me with a chair how to practice. So then I realized, that doesn't hurt so much. That's not so bad. The brain is coping with this. So I've been attempting it more in my daily routines in Tai Chi and in the Pilates, and I'm finding the inflammation has reduced a lot. And I think I'm sitting there thinking that's really interesting because I've always been saying I don't want to do that because it's painful,
Hmm.
but I've had to bypass that, the brain talking to me and what I physically can do. And that's two different issues going on there. What the brain says you can do and what you can actually do physically. And the third one is the fear. So you have to get rid of the fear. You've got to get rid of the brain talking negative, and you've got to do what your body is able to do. And that's how you start overcoming the cycle of pain.
Yeah. No,
I'll say full stop.
yeah. And then in terms of like when you're looking at your pain and diagnosis, do you find it helps to label your problem or
It
emphasis?
doesn't help because
Mm.
no one tells you how to manage that label or how to stick it down properly.
Right.
So everyone gives you a name and they leave you with the name and walk off. So if you're not savvy enough and you don't do any research, you sit with the name and you do nothing.
Yeah.
Mm.
That's why I feel that
So
should be described more so than the label.
the doctors nowadays, when you speak to them, they say they don't have the time, but it's called common courtesy. Yeah, common courtesy is that you welcome, you discuss, and then you end the conversation in a positive. That doesn't happen in the NHS anymore because they say they're overstretched. But I just think that 1 minute can make a big difference. And this is the thing that's not being used in our NHS at the moment because they say they're overworked. But they're overworked because they're making so many mistakes and having to keep on correcting the mistakes they've made because they haven't taken that 5 minutes.
Hmm.
So it's in everybody's interest if they are ill or they're feeling like they've got issues to do their own research. Because even if you go back to them and show them the research, they don't want to admit that a lay person, a person who knows nothing, can get all this information and tell them where they're at and where they're going with it. It's a very
Mm.
interesting thing, and that's why self-help, you help yourself and then you go back and you see them and they don't say, well done, you've moved a step forward. They stay silent. So technically speaking, they don't tell you you've improved.
Mm.
Interesting.
It's a really, really weird thing. And you just have to do what is right for yourself and to monitor
Mm.
yourself and know your body, know what is, if you feel something, that
Mm.
be comfortable to say this is happening and it shouldn't be happening. Because what we're meant to believe as well is that you're making this complaint, but you're complaining about nothing really, you know.
Mm.
And also, I believe with Black people, Black women especially, because the Black men are not so much into the NHS like the women are, because due to maternity and all different kind of issues, where they're more, we're left in pain longer. So it's not that we're brave. It's just it's a thing where oh, you've got a high tolerance. Black people have a high tolerance level, so they leave you with it. They don't find a solution for you. You have to be breaking down for them to actually say, okay, something is wrong. But if you say to them, okay, I'm having this issue, and you're quite calm about it, and you're talking to them, they don't acknowledge it in the same way. And so, therefore, the process of you getting better takes a lot longer. It's not that they want to stay with that pain for 20 years. It's because for 20 years they've been told, oh, just take 2 paracetamols. So it's not choices people are making, it's what you're forced into. And this is the NHS that we work and we pay towards through our taxes. We work hard and we presume that they're there for us. But the thing is, they're actually making us worse.
Hmm.
I mean, it is interesting just the whole thing that's going on in the NHS anyway, because you can see, the environments now, it's just a very stressed and strained environment. And one thing, so sometimes I will have clients, and I am very much part of me working in the NHS. There's always a part of me that supports what they're doing, but then there's
Yes,
another part of me which understands why people are so frustrated. And I always feel that the best scenario is, so when I get clients, for example, and they see me, and they might have ac someone access where someone in the NHS is looking after them, and they might see me. And now this is where even about the topic of the conversation is where I would always try and get them to get a diagnosis
from
through
them.
some of the machines and the equipment that they have.
Yes,
You
yes.
know. Now that I'm progressing with the ultrasound, that will be a different story from that perspective. Um, but it's now when you have that diagnosis from them, it's now what to do with that.
That's right.
You know.
Proactive.
Yeah, and this is where there's gonna always be that limitation now, and this is where people are going private because the NHS is stressed, strained, or whatever. And then we've got a whole different, at the same time, we got a whole different workforce, a whole different generation that are entering the NHS as well. So things change, things are
Mm.
evolving in a very interesting way. And I think
But
as
not
long
all conditions you can go private with,
no,
Christos.
no,
It's not all. It's
I understand that definitely, and not everyone can go private as well.
all conditions because for you to find certain conditions in the private, it's
Mm,
opening up a different world.
yeah,
You're
yeah.
already confused, and then some things like limbs and shoulder injuries, leg injuries, but sometimes there's other things going on, and it's not easy to step into the private world once you get to that stage. You need to be in already healthy before you can step into that realm with them, because obviously at that point you'd use your insurance if you already got insurance.
Mm,
But once you have certain conditions, you can't get the insurance to move
oh,
into that world. Um,
100%. And even at this stage, because at that stage, you're right, it is impossible for a lot of people to have any other alternative. And this is where, the work between healthcare practitioners that are serving, the communities and that, there's enough out there. And it's just looking at different models of supporting the community and that, because again, me and Sahu, as we do a lot of work and we support a lot of people who don't have the access to, just even the basics sometimes. And a lot of the times off our own back, we have to go above and beyond and do all these things, write all these extra letters, chase up the people that needs to be chased up, seek all these alternative provisions in the community just to meet people's needs,
Yeah.
and it's almost like where we've got a system which is struggling now to cater because now we've got doctors leaving because they're not getting paid enough. We get people unhappy, the morale, you know, the economy, everything is, it's not looking too bright
Yeah.
out there, So when we have all these things, it now has to open doors for better intuitive thinking. And I'm not saying it in a sense of just a politician with all these things and this is what we need to do, but it's actually has to be a real practical approach,
Yeah.
you know. So, when people are going to the classes, like things like the Tai Chi class, where it's helping them to manage not just the physical side, but you've got the communal side, you've got the mental side, you know. Then you've got all these offshoots from the classes where we've got different groups of people in these classes which can offer different things. So just the fact that, there's almost like a community and a network within
Community.
that, you know. And this is what's really going to help people in the future. That's the way I see it
So health.
anyway.
It's
You know,
true.
this,
It's true.
you
Yeah,
know,
it is true. Support
yeah,
outside of your norm, having a support group,
mhm, yeah,
and
and yeah,
and
and
it takes time to build, but it's happening.
no, 100% because there's more people needed, to add, other things, and as things build, and in time, I can see where, it will be taken back one's health is, as far as I'm concerned, my personal health, I can't leave to it's anyone, but that's me being a healthcare practitioner myself, you know. But in that same respect, it's up for to me and people like Sahu and others to again support the community in a more wider and holistic way and to keep building on it, you know, because I can see just, this is the vibe, and I'm never wrong about my vibe. I can see how the work we're doing is going to become even more needed in the future.
Hmm.
Yeah, I believe so too.
Mm.
Because as I said, if something's going on, there is no explanation, so you have to seek.
Mm.
And then, the, the NHS is not a holistic place.
No, no, no.
And
And
this approach would be really good if they were more holistic. It will save them money,
Yeah.
but they don't think in that way.
mm. And again, it ties into so many things. So, it's one's whole outlook. So, you know, when we're looking at health, I know for myself, I can see through what Sahu does and everything. It's very much a spiritual thing, you know. It's not just a physical thing as A equals B equals C.
Hmm.
So because one's on such a spiritual journey, it's a constant improvement of oneself. It's a constant elevation. It's a constant holisticness and, certain practices that has to be done. On my best, on my average game, I have to be doing some of the Tai Chi practices at least a few times a week. I have to do certain breathing techniques, certain meditations, and all of these things. And that's coming from a system and a culture, you know, which is has to look at all of these aspects, and just like when we're looking at food, environment, all of these things has to be really utilized and appreciated because a lot of these healthcare, I give you an example, a lot of these health problems that we experience as well is also certain environments and certain foods has to be maintained. I know a client that, you know, problems in this country with multiple joint problems. You ask if his parents have had similar problems or any of his relatives in the Caribbean, and it doesn't even exist. Now, as soon as he's in a colder climate, he's getting all these problems, you know. So it's this whole holisticness and the nature of, what individuals need to promote a full aspect of health and well-being. But where that can't be achieved because of the environment, then it's actually the knowledge and understanding of what can, mitigate that.
You can't say certain things in this society, even if it's proven that you have found that cure. You're
Mm,
very limited in what you can say if you haven't got that qualification and has joined that club of specialists. So you will never get recognized, even though you were helping people.
Yeah,
Oh dear.
so Mum, is that the last thing you're gonna say? So we got
Yeah.
all right. So Sankofa, thank you for that, Mum. Sankofa, you got anything to say before we finish up?
Thanks. Good evening. Yeah, it's interesting. I mean, I think Christos, you're describing an ideal situation where all of this investigation, different tests, the scans, all of that takes place in order to eliminate certain conditions that it might not be and to get closer to really identifying what the problem is. Whereas what they do in reality is they see you for 2 minutes, they make a diagnosis, they give you whatever treatment, medication they think will deal with that. And then you might end up coming back a month, 2 months later, having been affected by the medication, but your original problem still exists. So, yeah, I mean, you really speak about an ideal situation where all this investigation is taking place before, any treatment is dished out. So that's like a first comment, but it's also interesting what you said about pain. I mean, wow, all those different factors that contribute to how somebody experiences pain. But again, in the NHS, as soon as you say you've got some pain, they just want to give you painkillers. I
Right.
mean, it's a real, and it made real sense to me when I saw this drama called Dopesick. Have you seen it? Dopesick. It's about the Sackler family and how they came up with this medication that kills people's pain. Like they were on a mission in the States. I don't know if it's the 50s, 60s. They were on a mission to make sure that people did not feel pain. And they ended up making people addicted to this opioid. I mean, it's a massive scandal it was, and it's only after decades they actually were taken to court for producing this medication that was supposed to get rid of pain. So they're on a mission that people should not feel pain. I mean, and that's how I feel this culture, perceives pain. You shouldn't have to feel it, but it's telling you something. It's like, okay, you've got a problem going on here. Let's dig deep and find out what's going on in your body. It's not like eliminate the pain and get on with your life, So, yeah, that's just a couple of things you brought up for me in your presentation.
It's like it's a message. I love that. I love what you just said there. It's like they want to negate the idea that we experience pain
Yeah,
out of the whole consciousness. When
yeah.
it's such an important tool. Without pain, we wouldn't even be able to we just use the word diagnose any condition in the body.
Yeah. First you need the location, don't you?
You know what I'm saying? That is like the echolocation, the pain you home in, other than referred pain, that's a whole other issue. But that's
Yeah.
they went on a mission to negate pain back in the 50s. I must look into that one there.
Yeah, do. It's a big story. This pharmaceutical company, this family, really in the heart of the big American pharmaceutical industry, the Sackler family, and it ties into me with like capitalism, because if people don't feel pain, then they can continue working. Do you know what I mean? Just get to work. We can get rid of your pain. So yeah, anyway, going to bring politics into it.
I don't even know what a world without pain would be like. That's insane.
Nice.
I mean,
It might be more chaotic.
it's a funny old thing. That's found a world without stress. Not stress, because pain. Yeah, that's profound.
Pain makes it pain is a way that you know you're alive.
Mm.
So the old ones would say, innit? It's without
Yeah.
that pain factor there. No, they'll say, thank God without experiencing pain, no existence.
We know that you don't have, there's no pain when you're gone.
Hmm.
What people describe. And you know, I think people with, I think they were saying near-death experience or something, that, you know, what we perceive, the body can only tolerate X amount of pain. So above excruciating pain is almost like no pain, you
Hmm.
know, which is, yeah.
Goes like
I
white
would,
knights.
yeah. Thank goodness I've not experienced that one, so I can't say for certain, but
Things more painful that it goes silent.
yeah.
Mm.
But no, yeah, no, thank you, Sankofa. Yeah, it is. Yeah, it is. I think it's looking at ways, especially, you know, to serve the community. I think it's, you know, it's a holistic approach. You
Yeah.
know, from what we see with diagnosis and that, you know, we need a holistic approach, not taking things just for the label, looking and exploring, you know, to make certain of these diagnoses, but more importantly, doing something. Because the only question I had at the end of the Tai Chi and scanning was, what can I do about it?
Yeah.
People were not asking what was the problem. They could see what the problem was. I showed them what the problem was. I gave the name for the problem, but they weren't really interested in the name because if I go back to Tai Chi and I ask everyone, what diagnosis did I give them? Most of them will not remember what I said. If I said, what did I tell you to do? Most of them will remember what I told them to do.
Yeah.
Yeah, absolutely. Yeah, yeah. It's like what why has this arisen and what can I do about it? Like for me, that's what it is. I don't really, yeah, want to know the name. Although if a doctor gives me a name for something, then it does give you something to go and research and
Mm.
then kind of like address it in a whole more holistic way than just through the doctor's prescription.
Yeah.
But I'm interested to know what scans did you do? What did you use? Like, what did that look like? What did you do to people?
Also, it's an ultrasound scan. Yeah. So ultrasound, I can't show you because I put it away in the bag. So it's not in the clinic right now because I took it away to Guildford to scan more people. But it's an ultrasound scan where, have you seen like the black and white images? Not X-ray, but like black and white images. Um, Basically, what you have a probe and a machine. You put the probe on the area, and
Oh,
during our next presentation or one of the next ones, I need to get permission for the images so I can show you in real, you know, and I'll have the machine to show you in real time as well. But
okay.
the sound waves bounces off the tissue back into the probe and it generates an image. So it helps me with the clinical diagnosis. It helps me to see and pinpoint exactly what the problem is and be sure of the problem.
Right. So it's like what you have when you're pregnant. That scan,
Yeah,
that
yeah,
machine.
that's the one.
Okay.
Yeah, I should have
Right.
just done that one.
Yeah.
Okay.
And you see a proper image of what's going on in the womb. That's first
Yeah.
Yes.
like ultrasound.
But I'm not turning my service into Jeremy Kyle service and say you are the father.
We'll do none of them scanning there. Well, that ultrasound technology is advanced though, because I was watching some stuff when they were describing how, because of the wavelength, they can also help with resolving cancer as well. And they have a
Mm.
specific wavelength of ultrasound, which when you impact it upon an area like the liver, and you can
Mm.
scan in the liver, let's say, and you find that there's a patch where there is cancer, they got a special technology where they got a certain a higher frequency of ultrasound that they can
Hey.
bombard the area with the ultrasound and yeah, promote, we say healing, but they call it the immune system. to
Mm.
promote the immune system to start the healing process. So
Mm.
ultrasound technology. So even sound, when I was observing that it's like saying that even the device that you have, although, because they were saying that people go to get ultrasound scans. Yeah, this is a BBC thing I was watching. This is like last year. It was done, and they were saying that people who had scans, some people are being healed of cancer from a scan or from little
Mm.
tumors, not cancer itself because it's not at that stage, but
Yeah.
let's say the tumor itself. It's being resolved. Tumors are being resolved from ultrascan, and people don't even know it. They're getting better from the thing. They don't even know it. So that's why they've gone into all this research into ultrasound to actually see it as a therapeutic technology to heal the body as well, to support the immune system or to stimulate it.
Might have to do dolphin therapy.
You know
Just
what I'm
get
saying?
five dolphins in a poem through a human being in the middle of them.
Yeah.
See,
Let's see what the response.
I
And
mean,
what
you know,
about, sorry, I'm going to say,
oh,
what about our own ability to use sound? Either our voice, or instruments, to generate cells, regenerate cells and promote healing.
If you bring it
yeah,
back to ultrasound technology, it's what Chris was just saying with the device that you're holding in the hand. It's all piezoelectric. It's a
mm,
piezoelectric effect. So the thing sending out this signal, but it's stimulating on all this voltage stuff. So it's a sound
yeah,
wave in it ultimately.
yeah.
Ultrasound sound wave.
So they use the crystal. I think it's a quartz crystals in the probe, and then the electricity is hitting the crystals. The crystals are piezoelectric, so they change in shape. That causes the crystals to vibrate, and then the vibration sends out the sound waves from the probe.
Yeah. So
Yeah,
it's
so that's
sound
the
therapy.
piezoelectric you're talking about. Yeah.
Sound therapy.
So when you're getting them crystal sound bowls and all of that, you know, and you're setting them at different frequencies and that, you know,
Different
I'm
layers.
sure, yeah, I'm sure there's research or something out there.
Yeah, man, loads of research on sound healing and the effects on tissue and stimulating the immune system. That's what
Mm,
ultimately that they're looking at when they look at that stuff there, how the immune system starts a response in the body, how certain processes reduce or stop or restart,
mm,
reduces sending out certain chemicals and that stuff there. But it's true. If we're finding that on a subtle frequency, oh well, it's not subtle because ultrasound you can't hear it, but you can hear the sound of an ohm or the 132 hertz or the four five six whatever it is,
432, isn't it?
432 whatever, yeah, those hertz they can be heard in it, so they can
Mm,
use those sound waves can be used, but they are audible sounds
mm.
can be heard, but then it's those wavelengths are not heard.
Yeah, and then there's the heat effect that it would have, you know. So if I'm using the therapeutic ultrasound, because the waves are much stronger, you know, and the way I test it to see if it's working, because I'm always a skeptic. I'm like, I know the ultrasound machine's working, the diagnostic one, because I can see the image. But then I would question, okay, is my therapeutic one working? So then I would put in water once in a while just to see the waves
Hmm.
as I turn up the frequency. So that's how I am certain that it's working. But another way is if I'm treating the area, you can feel the heat
Generating.
because of the constant bombardment, you know. So, with sound waves, if we have to look at it in the general sense, it's something that, we can almost feel, the body can sense it, and it might experience it as heat. It might, when we're looking at the infrasound, that's the sound waves way below our hearing. We can even feel that as a kind of, oh, what's gonna happen here? The dogs will pick it up because they're barking before an earthquake. But we feel some type of unease in the atmosphere because I was looking into something and it was talking about when something bad is gonna happen. You can feel the whole shift in the energy, or you should be able to. If you can't feel it, then you might have to stop the McDonald's and all the other things blocking your receptors.
Yeah,
But you should feel something not quite right. Like I need to get the hell out of here. You know.
right. So
Um,
I think we're gonna come to an end, Christos. But the letter. You have anything you want to ask there before we leave? Or you have anything you want to bring to our awareness?
No, not anything to ask. I found it all very interesting. And I think it was Sankofa who was saying about just understanding how we understand pain and the lack of, I guess, and the word I'm going to describe is the lack of treatment for pain. It is just have some painkillers, but not actually what's the cause of the pain and what's the treatment for the pain, for the underlying reasons for it. But it was quite also interesting to hear about the ultrasound for cancer treatment. That's not one I've come across before. And I just wonder, with there being long-term research in cancer treatment or cure, do you think it's likely that this might be rolled out if it's proven to be successful?
Yeah, definitely, because that's what they was talking on that documentary I was watching. That
Okay.
at the moment they're just because he was explaining that to do the liver, the procedure that they was going through to resolve the liver is probably the most challenging one to resolve. And because it's situated deep within the tissue, and they're looking at small little explosions or traumas that explode with the ultrasound touching. So once they figure that stuff out and they've got the whole technology, I should anyway, next time we do this, I think we're going to I'll play some of those videos there.
Yeah, it sounds very
They're on their
interesting.
way. They're on their way with that one there.
Good.
And the good thing as well with that, it was a Chinese doctor, but they were showing how the before and afterwards, how the liver looked before with the cancerous tissue in there, the tumors, and then after treatment, I think it was about 4 months or something afterwards, how the area was totally cleared.
Very interesting.
Let's see how that stuff unfolds.
Sure.
That's all. Like it's for a couple more years, probably a little bit more in the selected individual trial kind of situation. Because when you're in them hospitals, because I noticed it when I was working in the oncology department in St. Paul's. Not everyone is privy to the same treatment process. Everyone may be at a similar stage, even if you've got a similar type of cancer, but then they'll offer different treatment types to different people. So not everyone will be offered those opportunities. And if you're aware of it, it's like you have to, be quite forceful with the option of taking it.
Sorry, I know this is kind of digressing a little bit because this is really meant to be about pain management, but that disparity in treatment, is that because of a perceived poor prognosis, or sometimes people's what's the word I'm looking for? People's attitude to a cancer diagnosis may determine their outcome.
No, you know what? That is a very good point, because when I was there, the people who had more of the higher end treatment, they were more optimistic and positive people. They're almost people, like I'm surprised they're even in there in the hospital with cancer. Like with their kind of mindset. It's like nothing should really affect their body. They shouldn't even be there. It was
Yeah.
it was those kind of people, and a lot of them was actually Eastern European that I would go through those type of more unique type treatments when I was in St. Paul's.
Yeah.
That,
Now, my understanding of Eastern European treatment, though, they tend to form a more holistic view. So perhaps where those patients may have already been exposed to it from before, whereas in the NHS, it's quite singular. It's diagnose, treat, medication. That medication doesn't work, we'll try a different medication, and there's another medication for the side effects of the original medication you were given. But
yeah.
I don't see very often a cure or a more beneficial type of treatment. And I think even echoing what some of the others have said today, sometimes where you've had an appointment with the doctor and perhaps the outcome hasn't really changed, maybe we need to empower ourselves to
Yeah.
find out where can we go to go and get the right type of treatment to give ourselves a cure or to improve our health, because we may not necessarily, although we're relying on the NHS, we may not necessarily get it.
Yeah. And that's what I agree with you. And that's what I was saying about even the diagnosis. Because if you utilize the £100,000 MRI or equipment, because I don't know anyone that's got that in their small clinic. I certainly haven't got an MRI, but if you utilize what they have, then you get a clearer picture.
Half a
And
million.
it is up for, £500,000. Then it is up to, us to empower oneself with the information. And I know for certain, 100%, that the parts are out there. There's no doubt. Whether the parts are known, and I'm beginning to even become aware of even my very own presence in the community where, yes, people know about me or people know about Sahu, but at the same time, not enough know about us. That's the reality. I mean, part of the proof is how much people has logged in today.
Yeah.
Another part of the proof is, you know, people will say, "Oh, you've been there for 5 years. How come I didn't know about you?"
That would be laugh.
And I'm sure so he's had the same conversation
You
being
disappear.
said.
That's
Yeah.
like what's that like that blindness when you're like, for example, you're in a car and
Mm,
what's it called? It's let's say it's a press button and you're looking for the wind up thing
mm.
to wind the window down and you can't find because it's a press button. If it's a press button and you're looking for the wind up thing and there's no wind up thing,
Yeah.
I can't
Yeah.
wind down the window, isn't it? It's like it's like those blind moments. That's how people go on in the world. You
Yeah.
pass a shop here, you don't see it. 5 years later, the same shop has been there. You walk past that thing every day. That blind
Yeah.
spot all of a sudden opens up on one day, and all of a sudden
Yeah.
you see it there. It's been there every day. It made me laugh, people. It's our awareness.
Yeah.
Our
But
awareness is so low.
it's changing. I can feel it changing out there. It's a
Yeah.
weird premonition where, yeah, I can see there will be more, things are gonna get bad to the point where we're gonna have to make them good. That's what's gonna happen,
As
really.
everyone said here, it's all about being proactive and taking, doing your thing, man, and not relying
Mm.
upon something outside of you to do that thing there, to listen to
Well,
yourself and to do that.
mhm.
Definitely. Can I just ask you, Brother Sahu, like as a Tai Chi teacher, Qigong teacher, and a physiotherapist, I mean, that must bring such an advantage to your students because, like, if somebody feels a certain amount of pain when they're holding a certain posture or doing a certain movement, how do you support them with that? With the,
Oh,
yeah, around pain, maybe.
Yeah, if we're doing it directly in class and we're doing a posture or we're going for a movement, then I would advise breathing through the process, breathing into the area, redirecting the mind, stimulating an internal smile, and go through all that kind of process. On the individual basis, then it comes to them doing the works themselves. I would either directly support, release the area during class, massage that space there. We do certain moments where we massage in a group. We do a line where everyone does a certain massage technique along the neck and shoulders and the back, especially if it's been a strenuous class. So we all will aid in each other's healing process. But
Wow.
the main way is when I would, because we got foam roller and them thing there, or the balls and that, or these suction cup devices. So in class, sometimes we may have there's been a strain to the neck or the shoulder, they'll be sitting down on the side of the suction thing on duck, 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 and it's releasing up the neck. Or yeah, man, there's so much different. But it's because, as you said, because I'm a therapist myself, I just apply my what I'm aware of in the moment, and it's just natural. Someone say that they got like one student the other day explained that they had a chest thing going on of their throat, like a spasm or something, like the asthma's come back. But it's like, asthma ain't come back. You just got a spasm. You just need to release the spasm, yeah? And then that coughing thing is gone. So then just described what to do. And all of a sudden, asthma, or the spasm's gone. It's just these things. But for me, I say these things for them to do themselves at home. And that's the most important part, is just I'm bringing the awareness on different options that can be done. And if you remember that, you need to do that. And if you come back and there's the same thing going on, I know you've never done that. It's so easy for the eyes to see when you know they're not doing the thing.
Yeah, so it's not about a label. You've got this, like you said, with the asthma, it's about what's happening physically in the body, that because you understand the body, you can say, okay, try this, or yeah, and that will release it or whatever.
Yeah. So we do that in class. There are moments where I'm like, okay, this is over the years. I'll do like a treatment session in class where everyone will come. I spend like 10 minutes and we go through different things in their body. But now, if you're doing pushing hands and there's tension in the shoulder, I'm just trying to soften that as well in the moment. Like release the shoulder, release the tension, release the space in that moment when they're doing it, helping them to let go and become more subtle in that. And all that reduces the pain. There's so much, sorry, Sanko, you asked that question there. There's so many things that we do in class. I just, wow.
That's amazing. Gosh, yeah, that's really good. Yeah, it's quite a unique opportunity that your students have, really, I think.
You see, and because it's an internal art, a teacher of a style like this should have that awareness, I feel. Maybe I have got an additional bonus of being a therapist. But as it's internal art, there have always been either acupuncturist or tweener, or they've been into the arts, calligraphy or something. That system of internal arts has always been into a holistic system in itself. So really, I'm just an expression of what the art should really be expressing in that sense. And if you're a Tai Chi or a Qigong practitioner, and you're not an acupuncturist, or you're not a person who's doing physical work, then you only understand a portion of the model. Yeah. And that's just the truth of an internal art.
Yeah. There's so many ways of viewing the body, isn't there, really? There is that TCM, that kind of internal arts way, and then there's the Western medical model, there's the, other holistic, so many ways of viewing the body.
We blend them. If we can blend them, then we're doing good. Each one have met their own model of the awareness,
True.
That's why, as Chris was saying earlier, it's like relative, isn't it? To our own perception of reality. But we here as practitioners, I think, are here to give the models and the awareness for you guys to take these models and nitpick or take which you can to improve your world in the moment. come back, and then add some other things to the equation. Make your
Yeah.
own formula.
Yeah, definitely. That's one big reason why I tune into you guys once a month for sure, to see what tips and techniques and understandings I can, bring to my reality. Yeah, definitely. Thank you.
It's a tapestry. It's a tapestry, isn't it? Of all these different wonderful things that we're trying to make a beautiful picture.
The age of doing now, not reading, not listening, applying. It's about applying.
It's true. It's true. And I can see that in so much different realms. Well, everyone, it has been a delightful talk. Definitely.
Thank you very much.
Thank you so much.
Christoph,
Yeah.
Ahu, thank you for
Thank
your
you.
time.
And we shall, back in a month's time, we may be
Just last
expanded.
comment.
Go for it.
Last comment. I forgot to say, Helen. I know we were saying about, the works and that. I just wanted to remind you of your role is very important because you're like the expert patient. Yeah. Your role is very important in this building up the knowledge base, because you have a good level of awareness, understanding within yourself, and you've got a really great level of experience, and you being who you are adds more value. So yeah, just you're very important in this equation. So just wanted to say
Okay. All right, Christoph, thank you for that.
right.
For all these wonderful comments this evening. It's been delightful. Yeah, and we look like we'll catch everybody next month. Hopefully, we'll just be going into it from a visual point of view. I'm unsure. We may do it as a continuation next month or the following month, and go into that off next month just to give a little space.
Okay, yeah.
But we'll see how that one day work out.
All right. All
Okay, well,
right.
thank you very much for
Take it
your time.
easy.
Have a good evening, guys.
Have a good evening, everybody.
Thank
Good
you.
evening, everyone.
All right,
Take over.
well,
Better.
Everyone in a month.
yeah.